Vaccination is a simple, safe, and effective way of protecting you against harmful diseases before you come into contact with them. Stated by the World Health Organization in 2021, during the height of the new wave of COVID-19 all over the world. In the modern world, vaccines are becoming more essential, especially for diseases such as COVID-19, an infectious disease that could develop into variants. Therefore, we need to ensure that inoculations are being distributed fairly to all people from different backgrounds according to the community infection rate. However, as revealed by the United Nations, only 1% of 10 billion doses have been administered in third world countries, and most of them suffer the most from the frequent battles of locally emerging diseases. This is evident in the vital need for vaccine equity, a problem the world has yet to achieve, consequently leaving many defenseless against diseases despite the development of technology in the medical field. Unfortunately, vaccine distribution depends on how much finances a country owns. This is because, to have vaccines, low-income countries must trade large orders with high-income countries that have already owned a large number of vaccines. This has led to the lack of vaccines in undeveloped countries, since they are not able to make vaccines available to every citizen due to the lack of budget and advanced technology required, while the national finances are not sufficient enough to cover large doses of vaccines. The unequal distribution of vaccines impacted two of the most essential aspects of humankind, society and the economy. A specific example that is very familiar to us at the moment is the COVID-19 epidemic. Vaccines and immunizations procedures show the disparities between nations. People who live in less developed countries have a lower chance of getting vaccinated, which also means less protection from diseases, some of which can be fatal for people with compromised health, while some countries are trying to bring the epidemic situation under control. Poor countries are still struggling due to the healthcare systems lacking necessary funds and equipment. On the economic side, it is easy to see some hindrances in business, manufacturing, and markets worldwide. According to the World Bank, the world economy shrank by 3.2% in 2020 when COVID raged and vaccines were not available. Vaccine shortages decreased herd immunity levels in areas, thereby increasing the number of people who need to be treated, leading to a drastic workforce shortage and unstable development, causing companies to gradually take a dive in profit and go bankrupt. Since Africa's main industries are labor-based, continuous in-person contact with unvaccinated will result in an even greater increase in the number of cases and a decrease in productivity. Meanwhile, more developed countries can adjust to the change due to the fact that they can rely on no contact, online work. As people risk perception of the virus wanes, careful risk communication and community engagement plans need to be adapted to enhance demand for vaccination. And domestic and international funding needs to be coordinated, available and swift to deliver against clear country plans. The COVID-19 Vaccine Delivery Partnership, a collective international effort with one country team, one plan and one budget, was launched by WHO, UNICEF and Gavi with international partners including the World Bank to intensify country readiness and intensify delivery support. To accelerate COVID-19 vaccination, concerted and urgent action from countries, international partners and agencies, along with G20 finance ministers, are required to increase vaccination levels and expedite access. Meanwhile, the sentiment cannot be said with many poor African and Asian countries. Coincidentally, these countries had but a much more significant amount of outbreaks and pandemics through decades of fighting emerging diseases. Africa's healthcare system was not equipped for a new global pandemic, especially one that would drain of the continent's resources. Most African countries were experiencing a drastic increase in unemployment and poverty than ever before, due to the lack of resources to fund new vaccine technology. Africa is entirely dependent on other countries' donations or orders from private companies. This does not help Africa's situation whatsoever. In fact, it further limits the chance of Africa providing its citizens with vaccination and covering herd immunity nationally. As an extremely developed country with advantageous economic conditions, with abundant resources in the medical scientific field, the US generates lots of profits from producing and providing lucrative vaccines globally. While Africa faces a shortage of vaccines, the United States, despite producing and stocking excess doses of vaccines, remains to have a high ratio of anti-vaxxers. According to NBC News in 2022, overproducing and underutilizing vaccines have led to over 82 million doses being wasted in the country. Even when it realizes that much-needed life-saving tools for others are being wasted, the pharmacy chain Walgreens reported that the Center for Disease Control and Prevention advises that it still needs to supply more vaccines, even if it leads to vaccine waste. Instead of being purely traded and distributed via commercialization, vaccinations should be prioritized for distribution to vulnerable nations. Global issues, such as those involving health and vaccines, are pervasive difficulties that cannot be resolved by one person acting individually. Instead, governments and non-governmental organizations must take these problems into consideration and bring alterations. In particular, during illness pandemics, countries should support one another rather than compete for the highest profit margin.